finish out chapter 1 and be done. Okay, so we've talked about anatomy and physiology, the terms and how they are related to each other. We've talked about what is needed for survival, how we organize the human body, the nutrients and other resources that we need, and how the body regulates and maintains homeostasis. So now let's go into the actual terminology portion of this course, and let's discuss those elements. So anatomical terminology, like we talked about in the beginning of this chapter, the reason why we even have this discipline is so that when we are communicating in the health field, we're understanding what we're talking about and we're speaking the same language. So in terms of referencing the body, anytime you are referencing the body, position of the body and things like that, you want to always reference the body in the anatomical position. So that's the body being erect, feet slightly apart, palms are facing forward, and thumbs are pointing out away from the body at the sides. So if you look at this diagram here, this is the anatomical position that we're talking about. We use directional terms so that we can describe one body part in relation to the other. And direction is always, like I said, going to be based on the anatomical position. Right and left refer to the body being viewed, not the right and left of the observer. So for instance, if you look at this diagram here, this is this individual's left hand, this is the left side of the body, and this is the right side of the body, an individual's right hand. That makes sense? So when you're looking at a human person, if you're looking at a person and you're talking about the right side is going to be their right side, not your right side. Keep that in mind, because you will have some exam questions that will say, you know, this organ is located in what quadrant, and you're going to want to remember, is it right or left? And it's right and left of the actual person that you're observing, not yours. Okay, so we get into some directional terms, and you do need to know the directional terms, know them by definition, and also be able to use them to complete a sentence. So let's start off with superior. So when you hear the term superior, think toward the head or the upper part of the body. And so an example of the term superior being used in a sentence is the head is superior to the abdomen. Inferior is away from the head or referencing the lower portion of the body. So an example of that is the navel is inferior to the chin. So our chin is here, our navel is inferior to the chin. We have two terms, anterior and posterior, and then we also have two terms that are used in conjunction with them. So anterior and ventral both mean front side or belly side, and then posterior and dorsal both mean back side. So examples of how we can use the terms anterior and ventral: the breastbone is anterior to the spine, so the breastbone is here, the spine is posterior. An example how we can use posterior and dorsal is the heart is posterior to the breastbone. So we've got the breastbone first, and then behind the heart, or on the back side of the breastbone, I should say, is the heart. Medial, lateral, and intermediate. So medial is moving toward the midline of the body. So when you think of the midline, think of a line being drawn straight down the middle of your body. So when we're talking about medial, we're talking about moving towards that midline of the body. So the example that the book gives you is the heart is medial to the arm. So the heart is, I'm talking about heart's over here. Heart's over here, arm is out here, so the heart is going to be medial, because if I go from the arm and move toward the heart, I'm moving medially to the heart. Lateral is away from the midline of the body, so the arms are lateral to the chest. So if I'm at the chest and I'm moving toward the arms, I'm moving away from the midline of the body. Intermediate is between a more medial and a more lateral structure, and so when you would use this term, I don't actually test you on this term, but I'll talk about it a little bit. You're talking about that middle area. So the collarbone is going to be intermediate between the breastbone and the shoulder. So basically in the middle between the two. Proximal and distal, these are two terms that students tend to hate because they're a little confusing, but hopefully we can gain some clarity on it. So when you're using the term proximal and distal, we're talking about parts of the body that are closer to or away, further away from the body part or the point of attachment to the body trunk. So proximal is talking about a part of the body that is closer to the origin of the body part, or it's the point of attachment of a limb to the body trunk. So think of your body trunk from the neck all the way down to your pelvic area. That whole area here, I know you can't see the body, my lower portion, but that whole portion of the body here is our body trunk. So then ask yourself the next question: what limbs are connected to the trunk? Arms and legs, right? So when you're talking about parts of the body that are closer to the attachment point of the body, think closer to the shoulders, closer to the hips, my legs and the hips. So we have a statement: the elbow is blank to the wrist. So the elbow is here and my wrist is here. So the elbow is going to be proximal to the wrist. The elbow is closer to this attachment point of the trunk than the wrist is. Does that make sense? And I can definitely give you more examples. There's examples in your textbook, and then if you wanted to talk one-on-one, we can definitely arrange that, so just let me know. Distal is just the opposite. Distal is referring to a body part that is further away from the attachment point toward the body trunk. So the example that the book gives you is the knee is blank to the thigh. So think of the knee and then your thigh. The knee is going to be distal to the thigh because the thigh is closer to that attachment point of your body trunk. The thigh is closer to the hip. The knee is further away. So the knee is distal to the thigh. All right, superficial and deep. Superficial is going to be toward the body surface. So the skin is superficial to the skeletal muscles, toward the body surface compared to the skeletal muscle. And then deep is away from the body surface. It's deeper. So the lungs are deep to the skin. Okay, and like I said, there are examples of these directional terms in your textbook, at the end of the chapter, and also within your textbook. So definitely take some time to go through those examples. And if you want to check those examples with me, you can send them to me in an email or you can call me and we can discuss them further. All right, regional terms. So we have two major divisions of the body. We have axial and appendicular. The regions of the body that fall in the axial portion of the body include the head, neck, and your trunk. So head, neck, and trunk. And then the appendicular portion of the body is going to include your legs and your arms. So we have regional terms that will designate specific areas of the body division. Alrighty, so when you are looking at these regional terms, I do want you to learn all of them because you'll need to know them for lab, but you'll also need to know them for lecture. So let's go over them just quickly so you have an understanding of what these terms are and what parts of the body they're going to reference. So we've got frontal for forehead, orbital for eye, nasal for nose, buccal for cheek, oral for mouth, mental for chin. Never understood why that term would represent the chin, but there you go. Then we've got the cervical area that represents the neck. The thoracic area is going to represent that upper chest area. So think from the diaphragm up as your thoracic area. So with the thoracic area, we've got the sternal representing the sternum, axillary, the armpits, mammary glands or breast area. Then we have our abdominal area, and associated with the abdominal area, you have the umbilical representing your belly button. Then we have our pelvic area. Pelvic area is right here. So associated with the pelvic area is going to be the inguinal area, which is your groin. Then you have the pubic area, which actually represents your genital area. All right, moving on to the left side of the body. So the upper limb, we're going to have acromial, which is the top of your shoulder. Brachial represents the upper arm. Antecubital is going to represent the I'm losing my words. Antecubital is going to represent the supine portion of your elbow. Antebrachial is going to represent this lower portion of the arm. Let's see, here we go. Carpal is going to represent the wrist. And then we get into manus. Manus is the term for the hand collectively. So we get into metacarpal, which is going to represent this middle portion of the hand. Palmar is the palm. Digital are your actual fingers. Then we move on to the lower limb. So associated with the lower limb, where's my mouse? We've got coxal, which is going to be our hip area, femoral for the thigh, patellar for the kneecap, popliteal is going to be the back portion of your knee, and we'll see that here. Crural is going to represent your leg. Fibular is going to represent the outer portion of the leg, the lateral portion of the leg. And then pedal is a term that we use collectively for the foot. So associated with the foot, we have tarsal, your ankle. Metatarsal is just going to be that middle area between your ankle and your toes. And digital is going to be a term that we use also for the toes. Looking at the posterior portion of the body, the terms that are a little different, we have olecranial is going to represent the back portion of your elbow. We have, like I said, popliteal is the posterior portion of your knee. We have crural, which represents the posterior portion of your leg. And sural is going to be what we call, what represents your calf muscle. And then lastly, I believe, no, we've got a couple more things. Calcaneal is going to represent your heel, the posterior portion of the heel. Otic is going to represent your ear. Occipital is the back of your head. Scapular, representing your scapula. Vertebral, representing your vertebral column. Lumbar is the term for your lower back. Sacral is going to be that lower portion of the posterior side of your back getting into the pelvic area. And then perineal is going to be the area that we find between the anus and the external genitalia. So like I said, you do want to commit to memory all of these terms representing the different parts of the body because you'll need to know them for lecture and lab. And a lot of the terms do make sense based on the parts of the body that they represent. On to body planes. So body planes and body sections. So we divide the body into different planes and sections so that we can study the body as a whole and really in its 3D version, now 4D version. So we have 3 common planes. Sagittal is going to be, and I'll take you to the picture because I think it's easier to show. Sagittal is going to be the plane that divides the body into left and right halves. So we can have mid-sagittal, that's always hard for me to say, which is going to divide the body into equal left and right halves. But we can also divide the body this way as well. That would divide the body into unequal left and right halves. So that's the first plane. Then we have frontal. So if we were to divide the body in a frontal plane, imagine a dividing line dividing us that way. If the body were to be split, it's going to split into anterior and a posterior half. So a front and a back half, or anterior and posterior half. And then the last body plane is going to be a transverse plane, where if we were to do a transverse cut across this way, we're going to divide the body into a superior and an inferior half. So all 3 of these body planes allow us to use our technology to get a 3D view of the body. So we can see the body represented this way, and also this way, and really view our organs in their 3D form. All right, let's see if I left anything out. Nope, I think that's it. Okay, lastly, we're going to be talking about body cavities and membranes. So body cavities contain internal delicate organs that need to be protected and closed from the rest of the internal body. The cavities provide different degrees of protections to organs, and for most of the body cavities, they do allow for movement of these organs as well. So we begin with 2 sets of our larger body cavities. We have the dorsal body cavity and the ventral body cavity. Based on those 2 terms, dorsal and ventral, can you guess where these body cavities are? So dorsal body cavity is going to include, it's going to be the umbrella that's going to represent the posterior body, the body cavities that we find on the posterior side of the body. So we have two subdivisions of the dorsal body cavity. Both of these subdivisions are going to collectively protect the fragile nervous system. So we have the cranial cavity that will enclose the brain, and then we have the vertebral cavity that will enclose the spinal cord. And so we have the dorsal body cavity here, and then the two body cavities that are inclusive of the dorsal body cavity include the cranial cavity containing the brain and the vertebral cavity containing the spinal cord. Now, when we look at the ventral body cavity, that's going to include the body cavities on the anterior portion of the body. So the ventral body cavity is going to include all of the body cavities from the base of the neck all the way down to our pelvic area. And we've got some subdivisions of our ventral body cavities, just like we did for the dorsal body cavity. So the first body cavity in the ventral body cavity will be the thoracic cavity. So we see the thoracic cavity represented here. Here's the anterior view, and then this is going to be our sagittal view of the thoracic cavity. In the thoracic cavity, we have technically three other body cavities. We have two pleural cavities, and the term pleural means our lungs. So we have two pleural cavities that will contain our lungs, and then we have the pericardial cavity that will contain the heart. And so when you think about body cavities, think about what are delicate organs that need protection? And most of us could probably call out brain, spinal cord, lungs, heart, reproductive structures, your digestive structures, and so forth. So all of these delicate organs are the ones that need those body cavities, that extra protection, so that they're not damaged when we get into accidents. Imagine, getting into a bad car accident or, running into something. These body cavities are going to add that further protection to these delicate organs that we tend to call viscera. When you hear the term viscera, think delicate organs. All right, so the thoracic cavity we have here, and in the thoracic cavity, we have two pleural cavities and the pericardial cavity, pericardial for the heart. Then we have the abdominopelvic cavity. Notice that the abdominopelvic cavity is separated from the thoracic cavity. What structure separates the thoracic cavity from the abdominopelvic cavity? Our diaphragm. So our diaphragm is right here, and the diaphragm separates those two body cavities. So in the abdominopelvic cavity, we have two smaller cavities. We have the abdominal cavity that we see here, and then we also have the pelvic cavity that we see here. The abdominal cavity is going to contain primarily the digestive organs, and the pelvic cavity is going to contain our urinary, bladder, reproductive organs, and our rectum. All right. One thing that I want to point out in the thoracic cavity, I'll go back to this picture. This middle area where we find the pericardial cavity, we refer to as the mediastinum. So in the mediastinum, this is the middle area that's going to separate the two pleural cavities, the two cavities that protect and support the lungs. And in the mediastinum, we're going to find the pericardial cavity, the body cavity that covers the heart, and we'll also find other structures like the esophagus, our trachea, and so forth. Okay, so let's talk about some homeostatic imbalances of this particular area. So problems occur when structures stray into neighboring cavities. So for instance, let's say you have a hernia. So when you have this type of hernia, part of the stomach will protrude into the diaphragm. So your stomach is going to be located in the upper left quadrant. Imagine part of your stomach getting through the diaphragm into the thoracic cavity up here into your chest. So you can push the stomach acid into the esophagus, causing irritation, heartburn, and in severe cases, this may require a surgical repair. So we have these body cavities not only to protect the organs, but also to keep them in the area that they need to be in so that functionally they can perform the best that they can. Now, associated with our body cavities, we have a another layer of protection. And the layer of protection that we have are membranes that we call serous membranes. So these serous membranes we find in the body cavities associated with the ventral body cavity. And the serous membranes we can also call serosa, and they're going to be thin, double layer membranes that cover surfaces in the ventral body cavity. So we've got two layers of these serous membranes. We have the parietal serosa, which is going to line the internal body cavity walls. And then we have the visceral serosa, which will actually cover the organs. And the visceral serosa, or the viscera, will actually be the outer layer of the organ that we're talking about. The double layers are separated by slit-like cavities that are filled with a serous fluid. And the purpose of these serous membranes is to reduce friction between the organ and the body cavity. So the body cavity protects the organs, and the serous membranes reduces the friction between the two, since we know most of these organs are going to expand and contract and assist in substances flowing through them, such like that. So the serous membranes can be named specifically for the cavity and the organs that they are associated with. So for instance, if we're talking about the serous membranes that are going to cover the heart and cover the pericardial cavity, we call those serous membranes pericardium because they're representing the heart and the heart cavity. If we're talking about the serous membranes that are going to cover the pleural cavity and cover the lungs, then we call those serous membranes pleura. And then representing the abdominopelvic cavity, we call those serous membranes peritoneum. And that, when I was learning it, I said, okay, this makes sense. The name of the serous membranes is very similar to the name of the body cavities associated with those structures. So here we have an example of the serous membranes associated with the pericardial cavity. So here we have the heart. This outer serous membrane is going to be the parietal pericardium. Parietal lets us know, okay, this is a serous membrane that's going to line the pericardial cavity, lining that cavity wall. And then we have the visceral pericardium. That's the part of the serous membrane that's going to actually be the outer layer of the heart, covering the heart itself. And then this space we call the pericardial space. That's where we find the pericardial fluid that's going to help reduce the friction between the two serous membrane layers. Does that make sense? If it doesn't, of course, let me know. So what happens when we have a homeostatic imbalance with our serous membranes? So serous membranes can become inflamed, and as a result, that can cause an infection or other cases. They can be inflamed due to infection or other causes. So normally the smooth layers can become rough, and they can even stick together, resulting in a very extreme pain. So if you think of pleurisy, peritonitis, or other type of inflammatory conditions associated with the heart, the lungs, our abdominopelvic cavity, those conditions can be caused by the serous membranes becoming inflamed. And imagine if they stick together, you're not going to have that fluid flowing between them that's going to be reducing friction, and that could also inhibit the function of that organ as well. All right, we're almost done. Getting into the abdominopelvic cavity and how we can discuss the organs associated with it, we can divide the abdominopelvic cavity into quadrants, and we can also divide them into regions. So when we look at the abdominopelvic cavity, we're looking at this area right here. We can divide them into quadrants, 4 areas. So we have the left upper quadrant and the left lower quadrant. Then we have the right upper quadrant and the left lower quadrant. So if we're looking at organs associated with these quadrants, we can say, okay, the majority of the stomach is going to be located in the left upper quadrant. The majority of the liver and all of the gallbladder are located in the right upper quadrant. The appendix is located in the right lower quadrant. So for instance, let's say you're working in the ER and the ambulance brings in a patient and they're running off the stats of the patient. And so they say, you know, gunshot wound injury to the right upper quadrant. You would automatically go, that gunshot wound could be affecting their liver and their gallbladder. And right away, you'll know these are the things that we need to do because these are the organs that are at risk due to this injury. So understanding the quadrants of the abdominopelvic area and the organs associated with it helps us to have a better understanding of how to know what organs are affected by the injuries that we can have. And as you can see, the large intestines and small intestines and the bladder cross multiple quadrants as well. So they're not going to be housed, obviously, in one quadrant. Now, with the regions that we can divide the abdominopelvic cavity in, we have 9 of them. So this is a small table, but this figure is also in your textbook. So we have the right and left hypochondriac region representing the right and left upper portions of the abdominopelvic area. Then we have the right and left lateral or lumbar region. And then we have the right and the left inguinal or iliac region representing the lower portion of the abdominopelvic area. In the middle of the abdominopelvic area, the upper portion is known as the epigastric region. The lower portion or the middle portion is referenced by the umbilical region. And then the lower posterior portion, middle portion of the abdominopelvic cavity is going to be known as the pubic or hypogastric region. Now, if you look at this diagram here, you'll notice that there's not really too many organs that fall in one region solely. You have the bladder that's totally in the hypogastric region. But if you look at the other organs here, most of these organs are going to cross regions. But even still, if you know where these regions are, and especially if we're talking about an illness or an injury to the body, you'll know what parts of these organs are affected because they are found in these different regions. For testing purposes, I do want you to know all 9 regions, so be able to label them and identify them in a diagram. And then for the quadrants, I do want you to know primarily where we find the stomach, liver, gallbladder, and appendix, what quadrants we find them in. All right, we have other body cavities associated with the human body. So we have the oral and digestive cavities, nasal cavities, orbital cavities, and our middle ear cavities. These are the cavities that are going to be exposed to our external environment. We do have some other cavities called synovial cavities that are not exposed to the external environment, and we find them internally. And we'll talk more about that later on in this particular chapter or the textbook. That's it for chapter 1. I hope that this was very helpful to you. And of course, if you have any questions about this, feel free to let me know. I hopefully will see you in the next lecture.